If you've ever experienced sudden severe pain in your big toe, especially overnight, there's a good chance it could be gout. Gout is one of the most painful forms of arthritis, and it often comes on very quickly without much warning. But the good news is that it is very treatable once you understand what's going on. In this video, I'm going to explain what gout is, why it happens, what triggers it, and most importantly, how you can stop attacks quickly and prevent them from coming back. I'm Dr. Bhadauria, consultant rheumatologist at Pure Rheumatology, London. Let's start with the basics. Gout is a type of inflammatory arthritis caused by a buildup of uric acid in the blood. When uric acid levels become too high, it can form tiny crystals that deposit in the joints. These crystals trigger a very intense inflammatory response, which leads to sudden pain, swelling, redness, and tenderness. One of the most common sites for gout is the big toe, but it can also affect the ankle, knee, wrist, or other joints. So why does gout often affect the big toe? One reason is that uric acid crystals tend to form more easily in cooler parts of the body, and the big toe is slightly cooler than other joints. This is why many gout attacks start there. Now let's talk about how gout presents. Gout typically comes on suddenly. Patients often describe going to bed feeling completely fine and then waking up in the middle of the night with severe pain. The joint may become red, swollen, and extremely tender. Even the weight of a bedsheet can feel unbearable. This is one of the key features that distinguishes gout from other types of joint pain. Now, what causes uric acid to build up? Uric acid is a waste product that comes from the breakdown of substances called purines, which are found naturally in the body and in certain foods. Normally, uric acid is filtered by the kidneys and removed in the urine. But if your body produces too much uric acid or your kidneys don't remove enough of it, levels can build up. Over time, this increases the risk of crystal formation and gout attacks. Let's look at some of the common triggers. Diet plays a role. Foods that are high in purines, such as red meat, organ meats, and certain types of seafood, can increase uric acid levels. Alcohol, particularly beer and spirits, is another common trigger. Sugary drinks, especially those containing fructose, can also contribute. Dehydration is another factor. If you're not drinking enough fluids, uric acid can become more concentrated in the blood. Certain medications can also increase the risk of gout. These include some diuretics, which are often used for blood pressure or fluid retention. Weight and metabolic health also play a role. Gout is more common in individuals with higher body weight, as well as those with conditions such as diabetes or high blood pressure. Now let's talk about what to do during a gout attack. The priority is to reduce inflammation and relieve pain. This is usually done with anti-inflammatory medications. These may include non-steroidal anti-inflammatory drugs, colchicine, or sometimes short courses of steroids. The key is to start treatment as early as possible. The earlier you treat an attack, the quicker it is likely to settle. Resting the affected joint and keeping it elevated can also help. Applying ice may provide some relief as well. Now, one of the most important things to understand is that treating the attack is only part of the solution. If gout attacks keep happening, we need to look at long-term management. This involves lowering uric acid levels to prevent further crystal formation. Medications such as allopurinol are commonly used for this purpose. Allopurinol works by reducing the production of uric acid in the body. When used correctly, it can significantly reduce the risk of future attacks and, over time, even dissolve existing crystals. However, it's important that these medications are started at the right time and managed carefully. There's a common misconception that allopurinol should only be taken during an attack, but in reality, it is a long-term treatment aimed at prevention. We usually avoid starting it during an acute attack unless there is a clear plan in place. Another important point is that lifestyle changes can make a difference. Staying well hydrated is key. Reducing intake of high purine foods and alcohol can help. Maintaining a healthy weight and addressing other health conditions can also reduce the risk of gout. Now, when should you seek medical advice? If you've had a sudden episode of severe joint pain, particularly in the big toe, it's worth getting it assessed. If you have recurrent attacks, it's important to look at long-term management. If the diagnosis is uncertain, further assessment may be needed to confirm the cause. At a rheumatology consultation, we would take a detailed history, examine the joint, and may arrange blood tests to check uric acid levels. In some cases, imaging or joint aspiration may be used to confirm the diagnosis. The goal is to make an accurate diagnosis and create a plan to prevent future attacks. One of the key messages I want to emphasize is that gout is very treatable. No one should have to live with repeated painful attacks when effective treatment is available. With the right approach, it is possible to control the condition and significantly improve quality of life. To summarize, gout is caused by a buildup of uric acid leading to crystal formation in the joints. It typically presents as sudden, severe pain, often in the big toe. Common triggers include diet, alcohol, dehydration, and certain medications. Treatment involves managing acute attacks and preventing future ones by lowering uric acid levels. If you're experiencing symptoms that could be gout, it's worth getting them assessed early. If you found this video helpful, make sure to subscribe for more content on joint health and autoimmune disease. And if you're concerned about your symptoms or would like a specialist assessment, I see patients at Pure Rheumatology London. Details are in the description below. Thank you for watching.